Welcome everybody to my free masterclass, Breathe to Thrive, on a Wednesday, 11th of September. My name is Dr. Amy Charlton. I'm a lifestyle GP. I started Melbourne Low Carb Clinic 2 years ago now, and recently I've started this brand new venture of mine called Breathe in Health. This is a new business that I've started, and I want to spread the word about breathing better, breathing healthier, and I have had tremendous success. So I want you to help me and spread the word about how to breathe properly. Let's start tonight with an exercise. I'm going to get you to find a comfortable spot, and we're going to do a breathing exercise to start the evening. All right, well, I'll get everybody to mute when you come in. Okay. So start making yourself comfortable. I'm going to invite you to close your eyes, make yourself relaxed. And I've got a little gong. We're going to do just 5 minutes of breathing exercise to try and get you relaxed. Okay. Find a comfortable position. Close your eyes. Make yourself comfortable. Let's start getting aware of your breathing. We're going to do a quick body scan. Relax your head. Relax your facial muscles and your jaw. Relax your trunk. Make your whole body floppy. Every time you breathe out, you relax a little bit more. Relax your hips and your legs and your thighs and your calves. There's nowhere you need to go to right now, but just do some breathing exercise with me for just 5 minutes. And then I'll tell you all the advantages of breathing better. Now we're a bit relaxed. I'm going to get you to become Superman or Wonder Woman. What I'll get you to do is put 2 hands along your rib cage with both hands and both fingers around your rib cage. And we're going to take deep breath in and feel your rib cage going out. We're going to take a deep breath out and we're going to feel your rib cage going in. Practice it a few times with your hands around your ribs. Take some deep breath in and see if you can feel your rib cage moving in and out. In this way, we can practice getting air into the diaphragm, getting way low into your belly, not just your upper chest. I'm going to get you to breathe in and out through your nose. We're going to start breathing in for 5 and out for 5. Let's meet on the next exhale. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5, and out, 2, 3, 4, 5, and in and out, and in and out, and in, 2, 3, 4, 5, and out, 2, 3, 4, 5. This time we hold 2, 3, 4, 5, and again, 2, 3, 4, 5, and out, 2, 3, 4, 5, and hold, 2, 3, 4, 5, and in and out, and hold. And now we're going to try and breathe a little bit less and try to be invisible breathing. When you're breathing a little bit less, try and do smaller breaths. Imagine a feather putting on in your front of your nose and you can't even feel it. The feather isn't even moving. Imagine it's a very, very light breath and the feather is not moving even when you're breathing. This is breathing light. So I invite you to gently awaken and come back. Notice how you feel. See if you're a little bit less stressed, a bit more relaxed than before. And notice that you can always come back to your breathing. Your breath is always with you. You can calm down, even just with a few minutes of slow breathing. Slow breathing can enhance your parasympathetic nervous system. Great. All right. Well, welcome, everybody. You can open your eyes, and that is just a very short breathing exercise. Might be ending up more than 5 minutes. How did everyone feel? I'll get you to put in the chat. What do you feel about this breathing exercise? Breathwork is a beautiful modality that takes us out of our mind space into our bodies. So a lot of people feel stressed and anxiety, too many things going on. And I ask you, do you suffer from anxiety? Do you have stress going on in your life? Do you feel like there's too many things going on? Does your husband snore, or does he say you snore, or does your wife say you snore? Or do you know you snore and you don't sleep well and you have sleep apnea? Or maybe you don't have anxiety, you don't snore, and you just want to live better. A lot of you might come from the low carb space that I work in, and now you just want to learn a little bit more about biohacking and thrive and improve your health naturally. So tonight, I'm going to teach you and tell you how breathing better can help you. Well, thank you for your responses. Your body felt light and relaxed and very relaxed. Great. This graph can show you what is going on. Let me explain to you. This is a normal breath is 6 breaths a minute in normal people. Back in 1929, people weren't breathing so many times in a minute. So people used to only breathe 4.9 breaths a minute. And then people were breathing a little bit more. And then back in the 1950s, people were breathing 6.9 breaths a minute, like 7 breaths a minute, which is still very close to 6 breaths. But life started getting busy, 7.8, 12 breaths a minute. Now, we are considering 12 breaths a minute as a good breathing rate, good respiratory rate in nowadays. In the medical literature, we're taught that 12 breaths a minute is normal, whereas this is actually way above. Back in 1920s, we used to breathe 6 breaths a minute. Who thinks this is surprising? This is a bit like in our low carb space. We used to be very skinny. Now, even overweight is the new norm. This is very, very scary. In fact, if you have chronic diseases like heart disease, diabetes, asthma, cancer, liver cirrhosis, epilepsy, panic disorders, anxiety, your breaths per minute actually goes up dramatically. So these people sit at 16 breaths a minute or 15 breaths a minute. Anxiety, quite often you have 13 breaths or a minute. Normally, normal breaths is 6 or 7 breaths a minute. I notice I breathe probably 12 breaths a minute, which I really should try and reduce it. And I try to retrain breathing, and which is why I try to help people to retrain breathing. The statistics is some people quote that over even up to 90% of the population breathes too fast, too much. But if you have anxiety, you have more than half a chance, 20 to 60% chance of anxiety that you overbreathe or hyperventilate. So this depends on the study. But if you have anxiety, quite often you breathe more frequent, you breathe heavier, which feeds into anxiety, which makes you breathe heavier, which feeds into anxiety. Anyone got any comments? You're most welcome to put in the chat. What do you think of what I'm mentioning? Who thinks you're breathing too much? So I am Dr. Charlton, Dr. A.V. Charlton. Last year I did a certificate with Oxygen Advantage, learned from Patrick McKeown. So you can check him out. He's got lots and lots of science to back him up about the power of Oxygen Advantage. And I've recently just finished training with Breathless, which incorporates the training from Oxygen Advantage and much more. I'm hoping to host breathwork classes to advocate about the power of breathwork and even take people on journeys on the power of breathwork exercises and classes. So just to say, this is not formal medical advice. You're most welcome to come and see me in the Melbourne Low Carb Clinic or Breathing Health, and I will perform medical consultations and you can treat me as a doctor and I can give you proper medical advice. These books are great. So if you're looking at learning more about breathing, I started with The Oxygen Advantage. And you can also check out Breath by James Nestor. James Nestor is not a scientist, he's a journalist. So he talks about how he discovered about the history of breathing and the history of chewing and the jaws, and there's such a amazing connection. And The Breathing Cure by Patrick McKeown, he claims to cure a lot of medical conditions, including these: anxiety, asthma, panic attacks, insomnia, which I think is great, but we need to combine lots of other lifestyle modalities. So Jody says, the world is more fast-paced and stressful these days. Absolutely, constantly stimulated by phones, etc. Unfortunately, I totally agree with you. We have too many notifications, we have too much things going on, and we don't even have time to pay attention to how we feel, and we're not mindful of what's going on in our mind. That's why our mind goes racing and we can't control our nervous system. We can't control our mind, which can be a big problem. So your relationship with your breath is your personal. Oh, did I record? Yeah, I did. Sorry. Your personal relationship with your breath is your personal religion. In all the religions, there's always something related to breathing. Like if you have Catholic, you go say prayers, the Hail Mary, or the Buddhism, they do they do lots of different things with breathing, and quite often they go om. That's to do with your breathing. So most of the religions that we've had always believe in concentrate on breathing. Now I'm gonna get you to check your respiratory rate. I'm gonna time 30 seconds and I'm just gonna get you to breathe normally, and you can count and you can let me know in the chat what your respiratory rate is. So we'll count for 30 seconds and we're gonna double it up. So we're gonna count in 5, 4, 3, 2, 1. So just relax and just do normal breathing, whatever you normally do, counting. And I'll tell you when to stop in a minute. That's 15 seconds. Keep going. And 2, 1, stop. Okay, well, let me know in the chat, how many breaths did you take in that 30 second? 8, 10, 6.5. So 10 breaths a minute, that's pretty good. So is that per minute? Sorry, Julie. And Narelle is 8 breaths a minute or 8 breaths per 30 seconds? Sorry, I didn't specify properly. I think anything per 30 seconds, Julie. 10 per minute. That's pretty good, 10 per minute. Julia was 10 per 30 seconds. So you've got lots of work to do. So you're 20 breaths per minute. Scott is 13 per minute. That's not too bad. So if you can get it down to less, that'll be even better. No, what if we're breathing too much? We all know that if you eat too much, it's not healthy. You can get fat, you can get overweight if you eat too much. What if you breathe too much? We all know that hyperventilating is it's an extreme. You hyperventilate and you go to emergency because you're in a panic attack. And what if you're not hyperventilating so much, but you're a little bit hyperventilating? It does cause a lot of problems. And if you hyperventilate, it can increase the risk of anxiety. It can increase your panic attacks. It can cause lots of medical problems. And you actually feel worse. So who thinks nose breathing or mouth breathing? Which is healthier? Put it in the chat. What do you think? I think this is quite obvious because now that I ask, everyone should know the answer. What happens is when in my medical consultations as a GP, when I ask people, are you nose breathing or mouth breathing? Most people don't even think about it until I ask them. And then some kids come in with coughs and colds when I ask them, mum and dad, are they nose breathing or mouth breathing? They don't even know. So it's good to notice that you really should be nose breathing. So I've got nose in all the chats. Fantastic. Well done. Nose breathing has so many benefits. There's actually 30 functions of the nose. Nose breathing, the nose is for breathing, the mouth is for eating. So don't use your mouth for breathing because your mouth is for eating. There is no function in the mouth that helps breathing because in the nose, you've got your nose hair, which acts to humidify the air that comes in. It helps the airways, soothe the airways. It's warm air when it goes into your airways. And it removes the bacteria and the germs. When you have air going into airways, into your nose, you produce this nitric oxide, which is magic gas. It is a vasodilator, which means it opens up your blood vessels. It regulates immune system. It also helps to fight bacteria and viruses. When you nose breathe, it activates parasympathetic nervous system and it gets oxygen better into the lower part of the lungs. When I got you to do Superman or Wonder Woman holding onto your rib cage, when you practice that, you can actually feel that your rib cage going in and out and make sure your air is going deep in your diaphragm. When you mouth breathe, quite often you use your upper chest rather than your diaphragm, and you can get dry mouth, increases your risk of dental caries. Chest breathing makes you more stressed. And if you're a child, it affects your dental development, which I will go into later. Increases the risk of snoring, sleep apnea, asthma, and you shouldn't be mouth breathing at all. So these kids who mouth breathe is actually quite detrimental to them. Back in the tribal days, there's mothers who go around actually closing the kids' mouth when they open their mouth. The pediatricians and the ENT don't look at it, and they just want to take the tonsils out because the mouth breathing makes the tonsils bigger. I think it's because the tonsils are developed because of fighting the germs that are going into the mouth. So tape, I mean, I haven't gone into mouth tape yet, but Jodie has alluded that mouth tape is a big thing these days for sleeping. Absolutely. Even kids can mouth tape. It sounds a bit cruel. And one of the mums actually say, is it child abuse to tape my kid's mouth? But I think if you do it properly and do it nicely to your child and explain properly, even practice during the day, I don't think it's child abuse. It's better for the jaw development and less chance of orthodontic treatment. This is from the Oxygen Advantage book. If you don't breathe properly, mouth breather, you're more likely to have a receding chin. If you're nose breather, your jawline is better well defined. So this is a poorer looking facial development, a facial figure, which is tired eyes, poor definition of cheekbones. The thing is, if you mouth breathe, your tongue isn't resting on the roof of your mouth where it should be. So you should always have your tongue on the roof of your mouth when you're breathing. All right. Anyone has any comments on that or any questions? So try to nose breathe all the time, and the benefits of the nose is so many that I haven't really gone into all 30, just gone into maybe 4 or 5 functions of the nose. Oh, thank you, Jodie, for the great information comment. Now we're going to measure your BOLD score, which is the body oxygen level test. So I'll get you to get ready, and we're going to do all this together, and you're going to tell me what your BOLD score is. This is from Oxygen Advantage. They call it the BOLD score. Breathless calls it the baseline score, which means exactly the same thing. So you might hear me interchangeably calling sometimes the BOLD score, sometimes the baseline score. So what we'll do, I'll explain it first, is we're going to take 3 normal breaths in and out. And then we're on the 4th breath, we're going to breathe in, and then we're going to breathe out, and we're going to hold for not as long as you can, but we're going to hold until the first distinct desire to take a breath. So not a maximum breath hold, not holding as long as you can, but the first feeling you need to take a breath. So some people can be quite short, and then hopefully I can help you to try and improve that. And some people, it could be longer, and you let me know how you go. All right, so I'll get you to sit in a comfortable position. So you can sit back, you can relax, and we're going to take 3 normal breaths. Normal breath in and out. Now I'm going to time you. You don't have to time. I'm going to tell at the time. Breath in and out. Last breath in and out. Sorry, one more breath in and out. We're going to hold, pinch your nose starting now. And I'm going to call out how many seconds it is. Now it's 5. The first distinct desire to take a breath. Now it's 10. Then you note how many seconds you can hold. Now it's 15. Not a maximum breath hold. Now it's 20. Not holding on to as long as you can. Now it's 25. When you feel like you need to take a breath, that is the time. Now it's 30. Just note the time, and then you can put in the chat. Now it's 35. And if you're keeping holding, now it's 40. If you're still holding, I really doubt there will be anyone. Now it's 45. Great. All right. Tell me how many seconds you've got. And I have had people that have improved these scores tremendously through 4 weeks of coaching when they come in to see me as a GP. Now, Jodie's got 30. That's fantastic. Julie's got 21, 15, 15, 25, 15, 15, 25, 20. Great. So 25 seems to be the magic number. So if you're over 25, you're more likely to be comfortable. If you're under 25, you probably need some training and improvement. So those are the 15. If you can train to improve your breathing, that'll be really great for your health. And I've had people that improve from 15 to 25 over 4 weeks, and which is fantastic. And they feel so much better. The thing is, they don't have to breathe as much. There's less work on breathing. So keep track of this baseline or BOLD score, and then you can work to improve on it. Now, this is another test. We're going to do a maximum exhale score test, or some people call it capacity test. What we're going to do is we're going to take 3 normal breaths, and then on the 3rd breath, you do a biggest breath in. We're going to do a very big breath in, and then we're going to slowly, slowly breathe out as long as you can through your nose first. And then when you can't breathe out through your nose, you push the remaining bit of air out through your mouth. Again, you don't have to time because I've got my trusty iPhone to time you, and then I'll call out the number of seconds, and then you just tell me the time and you take note of the time. So we're going to do 3 normal breaths, and then on the 4th, we take the biggest breath in. Normal breath in and out. Breathing in and out. One more breath in and out. And then the biggest breath in, big breath in, biggest breath in, and hold and start. And you're going to do the slowest breath you can, very, very slow, extending your breath ever so gently. Now it's 10 seconds. You're going to very slow breath in through your, out through your nose, 15 seconds, out through your nose. Now it's 20 seconds. If you can't breathe out through your nose, push whatever's left out through your mouth. Now it's 25. Keep going if you can. Now it's 30. Slowly, slowly breathe out whatever you can. Now it's 35. And then if you've still got any breath, keep going. Now it's 40. Now almost 45 now. And then if anyone's still going, now it's 50. Now it's 55. And last one I'll say is 60. Okay, well done, everybody. I've got Jody 22, Scott has 30, Nero has 35, and more 30, 25, 21. Well done. Now, the ideal is 60. So we should work up to 1 minute of maximum exhale score test if you're really good. I'm not up to that. I'm about 40 and I've improved quite a bit. So there's room for improvement. What happens is you get bigger lung capacity and breathing better. So I'm going to ask you again, do you snore or do you suffer from anxiety or stress? Put in the chat. Is snoring a problem or more anxiety or stress? Do you wake up with a dry mouth? Do you toss and turn during the night? Do you find yourself battling bad breath, waking up in the middle of the night to go to the bathroom? Feel like you're not fully rested after a night of sleep. So we've got stress and snoring and sometimes anxiety and stress. These are what we can improve. And with restoring your natural flow, quite often with breathing retraining, we can improve your ability to breathe through your nose. Some people think they can't breathe through the nose at all, and they've got deviated septum, or they've got blocked nose all the time, or they never thought about it. But through this training, we can learn to breathe through your nose. You might be able to clear the mucus and the congestion out permanently. We can learn to unblock your nose. You can improve your sleep. You can rest better, improve your energy, improve your motivation, enhance recovery from physical exertion. So even if you're exercising, if you breathe through your nose when you're exercising, that can really help to improve the exercise tolerance and improve your recovery, which is magic. So it really will help you train better and perform better. And there's lots of athletes that actually do that. Some athletes actually tape the mouth, run a half marathon. I'm not that, but it is quite magic. It's hard, and you might need to go one step backwards to go 4 steps forward. So remember that. And you might have symptoms of anxiety alleviate, improve concentration and cognition, less allergy, colds, and improve immunity. More benefits of improving functional breathing. You get less germs, you get less infections, you warm the air, better water balance, improve oxygenation, improve taste and smell, improve your asthma, allergy. I've had a patient today with eczema, and he has improved his eating, which has improved his eczema. I'm prescribing him with breathing exercises, hoping that he'll improve his eczema even more with improving the breathing as well. So some of us know low carb, and we know this is like the tip of the iceberg. Is we see the metabolic dysfunction, the tip of the iceberg. In breathing, it's very, very similar. Nobody talks about breathing, and what you see is only the snoring and the sleep apnea. You think it's a problem? The modern doctors just treat the snoring and sleep apnea by giving you a CPAP machine. But there's so many things that contributed. We know that poor nutrition, eating too much carbs, bad posture, poor sleep hygiene, overweight, sighing, yawning, mouth breathing is big. Over breathing is big as well. That all contributes to sleep apnea and snoring. This slide is courtesy of Breathless, which I trained with. So again, these are the signs that you're not breathing well at night. You might have restless legs, you might have snoring, you might have headaches in the morning, you might be feeling anxious, depressed, daytime sleepiness. Now I'm going to share a story, and I'm not going to name him because he knows that I'm sharing his story. He mouth breathed a lot of his life, and he had sleep apnea when he was 18. He came in to see me, and then he heard about me talk about breathing. Within 3 days, he changed his mouth breathing to nose breathing. So he's about 50 odd something, and he's paying more attention, doing mostly nose breathing. So he's improved his eating, his low carb, and doing very, very well with improving eating. Within 3 days of nose breathing, he's improved his snoring so much that his wife said he's improved 80% of his snoring, and his restless legs is much better. He's improved his mental function. He's working better. And I am so pleased because he is functioning so much better. So I hope he doesn't mind me sharing his story, because that is totally amazing story. He functions so much better just by switching from mouth breathing to nose breathing. Snoring is 80% better within 3 days, and cognitively functioning much better. So I'm going to prescribing you with breathe less exercise. Less is more. Breathing less will get you more carbon dioxide to improve oxygen absorption. I'm just going to touch on science just for 5 minutes. Otherwise, it gets too technical. With breathing, it's carbon dioxide which initiates breathing rather than low oxygen. So if you think you're not getting enough oxygen, that is actually not true. If you're having a panic attack, you're actually getting you're sensing too much carbon dioxide. Maybe your body is taught that you need to breathe by a little bit of carbon dioxide. So what happens is, if you have oxygen coming from the lungs, the oxygen gets bonded to the hemoglobin, and the oxygen will eventually get released to your muscles and your brain. If you have a look at the curve, if your body can hold higher carbon dioxide which makes your pH go down, look like this man running better. Your oxygen in the hemoglobin actually gets released into the tissue a bit more. So what I'm trying to say to simplify it is if you have higher carbon dioxide in your bloodstream, you actually improve oxygen delivery to your muscles and brain, and you function better. So how do we get more carbon dioxide into your bloodstream? I'm going to prescribe you with the pill called LSD. How's that? Who wants LSD? Laugh out loud. Great. All right. I'm not a drug dealer. I do prescribe medications. So LSD means light, slow, and deep breathing. So this is LSD breathing, not the stimulant. So we're going to practice breathing light, just like the initial exercise that if you put a feather next to your nose, you're not even moving the feather. So we want very light breathing, or we call it hibernation breathing. Very, very light breathing. You're not even moving the feather. So light breathing actually increases the carbon dioxide tolerance and makes your body build up with carbon dioxide. We want slow breathing. We want to slow down our breathing. If you're breathing 20 breaths a minute, 12 breaths a minute, maybe you can practice 6 breaths a minute. What 6 breaths a minute is you breathe in for 5 and out for 5. So you can practice in 2, 3, 4, 5, and out 2, 3, 4, 5. And that is actually called coherent breathing. The heart and the lung and the brain work together in coherence. And if you look up my podcast in episode 24, I talk about 365 breathing exercise, which guides you to a 5 minutes of these breathing exercise. Breathe in for 5 counts, breathe out for 5 counts. If you have an anxiety attack, if you remember this coherent breathing, you can remind yourself to breathe in for 5 counts, breathe out for 5 counts. And quite often that can actually get you out of a panic attack, get you out of an anxiety. If you're driving along, you're stressed, remember, if you breathe in for 5 counts and out for 5 counts, that is actually quite an easy way to regulate your nervous system. If you do this 3 times a day, 6 breaths a minute, 5 minutes at a time, that's what we count. We say 365 breathing. And if you do it for a week, and that will actually really help you with improving your nervous system, calm your mind down. Now, the deep breathing is into your diaphragm. Remember the Wonder Woman and Superman hold. You hold your fingers along your rib cage. You practice moving your fingers with your rib cage. Then that's deep breathing. So this is my LSD that I prescribe for you, is breathing light, breathing slow and deep into the diaphragm. So breathing light regulates the biochemical aspect, which means we're learning to hold on to more carbon dioxide. Breathing slow regulates the cadence, and we slow down, we activate our parasympathetic nervous system. Breathing deep will activate and get more air deep into the bottom of the lungs, activating your diaphragm, which actually helps with functional movement, training your diaphragm, which is a big muscle in your body, helps with core strength as well. So just be cautioned, some breathworks can be, just be careful if you're pregnant or if you have panic disorders, which is not controlled. Sometimes it can help, but some people can set them into worse panic disorders. If you have uncontrolled hypertension, we suggest you to control your blood pressure first. Obstructive sleep apnea, sometimes you have to be careful, or severe heart disease, we have to be careful as well. The magic of breathwork. In the future, I really want to hold breathwork classes, which can help you with going into a breathwork journey. It takes you into relaxation and even takes you into an altered conscious state. It can help to release trauma and release emotions when you do a breathwork release. And that is one of the amazing things that can get you deeper into a relaxation and get some of the old traumas out. You don't even have to talk about it if you've been damaged or abused as a child or had some traumatic events. And actually, there's a lot of us that had acute childhood trauma scores that that we have some trauma going on. So breath work can do something like that, get you out of into a different conscious state. Regular breath work gets you more into self-awareness, practicing mindfulness, increase your energy level, boost your immune system. I see people with frequent coughs and colds, and I ask them if they're breathing through the nose or their mouth, and that can be a reason why they're getting lots of colds, and even kids with coughs that lingers on. And you can control your nervous system. If you have anxiety, you can do coherent breathing. Breathe in for 5, breathe out for 5. Sometimes that can get you regulated in your nervous system. Can help you focus and improve creativity, improve self-love, relationship, oxygenates the blood, improve stress and anxiety, improve your pain, make you more present and enjoy your life, improve your sleep, open your heart space, improve digestion. This is your heart, body, and mind gut connection. Lowers blood pressure. Might be able to get off that blood pressure tablet if I'm prescribing that to you. You can help me de-prescribe it. So I've talked about a lot of benefits, and I've developed this course which will start next week. If you sign up, you can get instant access to some of the recorded material. And this is a very, very cheap price of $49 for a 4-week online breathing course. Yeah, thank you, Jody. I think it's a bargain. I don't know why I'm priced it so cheap. This is the first time that it's going to be so cheap. I'm going to price it up next time when I release this again. We're going to have 4 live Zooms starting next Wednesday. So for the next 4 Wednesdays, I'm going to do a talk. We're going to have some coaching and maybe some breath work. And we're going to talk about how you're going to improve your breathing. I'm going to give you structured exercises. So knowing LSD is pretty good, but I'm going to give you exercises to do how many times a day, how many minutes, and I want you to feedback with me. For me, you're going to do the scores and you're going to do a questionnaire, and the questionnaire will be about your symptoms. I've had maybe 6 or 7 people go through this with me in my clinic, and these people have all improved their symptoms. They've improved the BOLT score and they've improved their max exhale score fantastically. And I've actually discharged them. So I said, off you go. You can keep doing your breathing exercises and you'll keep improving, but you've improved so much that you don't have to see me anymore. I think that's not quite good for my business, but it's improving their lives a lot. So actually not keeping them coming back to see me. So with the course, you're going to get the 4 live sessions on Zoom. You're going to get unlimited email support. You can email me and I will email you back. And there's lots of breathwork recordings that I've done already, and I will keep doing more breathwork recordings. And you're going to get some live Zoom breathwork sessions, probably on a Sunday and maybe on a weeknight. So I will pop in the chat on how you can join me in this course. So and I will email you again. The course is starting next Wednesday with the first live Zoom, but you can purchase and you can get access to the recordings already. And there's lots of breathing exercises. There's 10-day breathe together with me. And there's a couple of 20-minute breath work. And you can start straight away. So I want you to take home 3 messages. First, be breath aware. Notice nose or mouth. Slow down your breathing and know where you're breathing from. Just notice your body. Less is more. So breathing more isn't that good. Don't breathe more. Breathing more is hyperventilating. And then if you go to emergency, they'll give you a brown paper bag to increase your carbon dioxide breathing in. Quality over quantity. So more is not as good. If you are keen to do one-on-one breathing retraining, if you have a mental health plan, then you can get more Medicare rebate. If not, I will see you for half an hour for breathing retraining for the same price as I see people in the low carb clinic to talk about low carb. And but if you have a mental health plan, you get a little bit more money back for a 30-minute consultation. So, and I can do a mental health plan for you. This is my new accreditation that I can help people with mental health plans. So you can check me out on my website and my social media, and there's so much information that I've put out into this. And you're most welcome to have any questions. I can stop screen share, and you can even unmute yourself if you want to ask any questions. Or put your hands up if you have any questions. How have you found this talk? Do you think it's helpful in learning about breathing and getting you to breathe better, improve your health? I have found that everyone's got room for improvement. Thank you, Deb. So you might decide to run with your mouth closed and see if that can help. But you have to be prepared to take one step back for 4 steps forward. Thank you, Jody. You want to do the course? Thank you. Great, you're willing to try. I have changed all my running breathing to nose breathing unless I'm sprinting at the end of a kilometer in park run. So, and I have felt that I'm calmer, I'm recovering better, and I'm not as fast as before, mainly because I'm just too busy, so not running as much as before. Mouth tape is great. Takes a day or so to get used to. Absolutely. I haven't gone into mouth taping that much tonight, but if you don't know if you're breathing through your nose or breathing through your mouth at night, or especially if you're waking up with dry mouth, then you should try mouth breathing. I usually say to patients that give yourself a week. If you're taping your mouth, the first 2 nights, you might only last 2 hours or 4 hours. And after a week, you might get used to it a bit more, and you might be able to last a whole night with taping your mouth. Yeah, so improving your sleep, that's fantastic. And some people even find if they tape the mouth, they don't need to go to the toilet to wee in the middle of the night, because this is the hormone effect. And you're sleeping better and you wake up better. And some people that I've found, they have anxiety, they're not quite ready to tape their mouth. But if you concentrate on nose breathing during the day, quite often the more you nose breathe during the day, you can do more nose breathing at night as well, even if you just can't quite tape your mouth. Some people can't grasp the idea of taping their mouth. Julia says, I didn't realize how important breathing is for over a health journey. Look forward to learning more. Great. All right. I hope you join my course for a very, very cheap $49. I'm hoping because it's so cheap, I can get more people participating. There's about 7 or 8 people that I've coached in my clinic, and they have tremendously improved their health. Then I've been doing some breath work with them one-on-one, and I'm hoping to do breathwork classes. If you have a mental health plan, then that'll get you mental health rebates under the mental health plan, even when you come to my breathwork classes when it gets launched. So Leanne says, John and I have read Jane Nestor's book, and we mouth tape each night and have noticed improvements. Sleep better, don't need to get up as much during the night. This is fantastic info, needs to get out to everybody. Thank you. Now, in a couple of days, or maybe tomorrow or the next day, I will put it on YouTube. If you want to spread out the message, you can put this video out and share to your friends for me, because it'll be public and I will put it out on YouTube. So yes, I'm trying to spread the information out. And you can share my information out to any of those friends that you have. Yes, Jody, this is recorded. I just checked, it is recorded, and I will put it on YouTube and it'll go out into the public. So if you want to share it far and wide, you're most welcome to. And hopefully they do join my class. If not, hopefully they do just get some benefit out of it. They might just get the LSD, breathing light and slow and deep, and that will help them too. Fantastic. Of course, I want monetary back, get some money back. But if it's not about money, it's about helping, spreading the word. That is fantastic. Thanks for the awareness. Great. All right. Fantastic. Thank you so much. And I'm happy to stay around if anyone's got any more questions. Thank you, Doctor. Thank you, Julie. Well done for coming here. So I have found that I have improved on my breathing and I'm much more mindful about my body. When I've started the journey, I used to do 5 minutes of meditation, and then I switch it to breath work. So 5 minutes, and I have Insight Timer app, and I would do a class each, and I would do one breathing exercise, maybe a box breath, maybe just slow breathing. Sometimes it's a ladder. So with breath ladder, you just get guided and climb up the ladder, holding on to longer and longer. Now I feel that it's so good that I'm craving for more breath work. So from 5 minutes a day to sometimes 15 minutes if I have a little bit more time. And on the weekends, I enjoy it so much that I do 30 minutes of breath work guided with my breathwork app, and it guides me into a breathwork journey. It takes me into from slow breathing to fast breathing. The fast breathing gets me stimulated and tingling, and then afterwards I get into a much more deeper breathe relaxation. So I enjoy it so much, and I feel like I'm so mindful that it sets me up for a good weekend. So on a weekend, I've got more time to do these breathing exercises. And I've even gone into a breathwork studio called the Breath House in Richmond. The Breath House, I think it's about $30 odd. I'm not affiliated with them, although I might think about approaching them and getting to know them a bit more. So the Breath House, you can sign up for a 1 hour breath work class, just like a yoga class or a pump class, and then it'll be guiding you to do breathwork journey. It's lying down with a blanket and a bolster. Feels amazing. I've come out really relaxed, all set up for the rest of the weekend. So you can check it out if you want, not affiliated. Julia says, if we were to pick a book to read as a newbie for more info, which one would you suggest? I would say Breath by James Nestor. Breath, I can't remember the full name, but it's really easy to read and listen to. I actually listen to audiobooks because I go out walking and running, and it's perfect for me. So Breath, the New Science of a Lost Art by James Nestor. I would say go and get that book and listen to his journey. So in the beginning of the book, he taped his nose for, I think it's 2 weeks. So he forced himself and Andrea Olson, I think. Andrea Olson is the owner of Conscious Breathing. So both of them taped their nose. They stuck tissues up into their nose, and then they forced themselves to mouth breathe for a 2 week. Oh, he's on direct. Yeah, okay, great. So they forced themselves to mouth breathe for 2 weeks. And then after 2 weeks, they felt anxious, they're not well, they're tired, they didn't sleep well. So they felt terrible. And then they changed over and went back to nose breathing, and they felt so much better just going back to nose breathing. So that is quite dramatic. But if you're a child and you haven't been warned about mouth breathing and you've gone mouth breathing the whole way, it's probably so subtle you don't even know that you are going through the journey. So yeah, I would check out James Nestor on DOAC as well. DOAC is the Stephen Bartlett podcast, Diary of a CEO, I think. Yeah. So he is great. And there's lots of information from James Nestor. If you Google him, there's lots of podcasts from lots of different channels. There's courses from lots of different places, and you can check out all the information. So it's amazing. Anyone has any questions? All right, well, might call it a night. You're most welcome to message me or let me know if you have any more questions, and hopefully some people can join my course. And we're going to go for 4 weeks. Even if nobody turns up, I'm still going to I'm going to prepare the slides and record the talks. So hopefully some of you will join me, and then I will get you to do the questionnaire before and 4 weeks after, and I'm going to see improvements in those scores and symptoms. All right. Well, thank you, everybody, for joining me. Thank you. All right. Have a good night, everybody.